Chronic diseases account for 7 out of 10 deaths in the United States and drive more than 80% of healthcare costs. In 2005, Starbucks announced that it spent more on workforce healthcare costs than on coffee, and General Motors and Chrysler announced that they spend more on employee healthcare costs than on the steel they use to make cars. Employers don't only pay the cost of chronic diseases via healthcare costs. Businesses also suffer from reduced workforce productivity and lack of innovation. Workplace health promotion programs can effectively improve employee health, but they are insufficient on their own. At the end of the day, employees go back to their families and their communities, and it's the community factors that largely impact their health. These factors include government policies, education, access to healthy housing, access to healthy food, and opportunities for physical activity. And it's these factors that can either undermine or actually synergize with workplace health promotion initiatives. We currently know 2 things. In the US, health varies across industries and across counties. For example, we know that the workforce of the manufacturing industry has higher prevalence of obesity and hypertension than other industries. At the same time, the workforce of the entertainment and arts industries has a lower prevalence of obesity. We also know there are drastic differences in health across counties in the US. And while a county in Mississippi can have physical activity rates of 60%, a county in Colorado can have physical activity rates as high as 90%. Our report demonstrates the linkage between workforce and community health and identifies 3 strategies that businesses use to invest in the health of their communities, which can also be leveraged by community groups to engage businesses in local health promotion. We also offer employers guidelines to make quality investments in community health and feature case studies that demonstrate these practices. It is time for workplace health promotion initiatives to extend beyond the 4 walls of the workplace, and we need cross-sector collaboration to accomplish this. We urge employers and community groups to use the strategies outlined in the report to work together to improve the health of their communities. While we need action, we also need to advance the implementation science of business investment in community health to know what works and what does not, so we can scale up going forward. We urge employers to partner with local health departments and research organizations to evaluate their initiatives so we can have sustainable investments in population health going forward.